My name is Gordon Moore, and I was a young doctor in 1969 working at the Mass General in infectious disease. There was a very, very courageous dean of Harvard Medical School. His name was Bob Ebert, and he really was the papa of this organization. His dream was having a community health plan that would serve people in a community and at the same time also be educating young people to be really great at primary care. The early history was not an easy one. The objective for the first opening of the plan was to have 5,000 members. On the opening day, Harvard Community Health Plan had 88 patients. There were more staff at that time waiting around to see the patients than there were actually patients.
Many companies develop all their processes and products based on what's really good for them on the inside. We look at things from the outside in. We try to understand how are we designing our products and solutions and how are we delivering them to make sure we're not excluding anybody.
We've been really lucky to be able to do a number of really innovative things here. We were one of the first to pilot a mindfulness program way back in the early 2000s. As our model changed and as employer wellness became more of a thing, we really moved to delivering services through the employer, but as we start to get more digital tools and we're able to kind of scale some of our programs, kind of coming full circle in a way.
What falls under the umbrella of wellness, it's really quite broad. Maybe it's financial wellness, maybe it's stress management, mindfulness, exercise, a lot of different things that can get added into wellness. We've typically been on the cutting edge with a lot of our programs so that employer groups say, ooh, I'll try that, which is a great plus.
There are stories of how when we engage employees in wellness programs, things as simple as a blood pressure monitoring has saved the lives of an employee. And it makes me very proud to be part of the Harvard Pilgrim healthcare community. In the sales department, we count on the collaboration of different departments to be able to deliver, because they're purchasing more than just claims that we're paying and processing for them. They're purchasing a whole structure of people that are behind the scenes that really care about the delivery to their employees.
Community is the bricks and mortar of this organization, plain and simple. It was a mission I believed in. It was an opportunity to do good for a lot of people. I mean, it was really the best experience of my life.
This is the company that I've been with since I graduated college. When you have someone come up to you and say they love Harvard Pilgrim and we made a difference, it really makes it worthwhile.
We have a lot of employees who have been here many years who carry that legacy forward. And we've added in employees who offer a fresh look on how to meet the challenges of healthcare. So collaborating together, I think we're going to be a very powerful force going forward.
The things that the founders were thinking about in 1969 are even more relevant today. We have to make healthcare affordable to all. We have to make it accessible. That inspiration has to be what guides us in the next 50 years.